everyone. Hello, great surgeons. Today we are going to start our first session of physiology. We will discuss arterial blood gases and electrolytes. Electrolytes will involve sodium, potassium, calcium, and magnesium. We will start by discussing arterial blood gases. Please, before I start, take your own notes while I am explaining. Okay? Initially, I will start by what do you know about ABG, arterial blood gases? Okay, arterial blood gases, I should know normal pH of the body. I should know normal level of arterial pressure of the CO2, oxygen, and bicarb. Please keep these numbers from 7.35 to 7.45. CO2 4 to 6. In some books you can see it from 35 to 45. Okay, 4 to 6 kilopascal. Okay, PeO2, which is normal between 90 to 100%. By kilopascal, it is from 10 to 13, while HCO3 is from 22 to 26. Okay, this is the numbers which you should keep them. So please keep these numbers: pH, PeCO2, PaO2, and HCO3. Okay, then let's start. First one. Here is the normal PeO2, which is from 10 to 13. Normal pH from 7.35 to 7.45. When it became low, it is acidosis. When it became high, this is alkalosis. PaCO2, which is normal from 35 to 45. It is written here wrong, 35 to 45. And here 4.426 kilopascal. HCO3 from 22 to 26. Okay, so when I am speaking about PeCO2, so it is a respiratory pattern of a change, either alkalosis or acidosis. HCO3, it is a metabolic pattern of a change, either acidosis or alkalosis. So please keep this. PeCO2 is regarding respiration, HCO3 is regarding metabolic changes. And here we will discuss how to deal with electrolyte exchange. Initially, here is the normal pH. When it became low, this is acidosis. When it increased, this is alkalosis. This is simple. When I am speaking about PeCO2, so it is a respiratory pattern. When I am speaking regarding bicarb, this is a metabolic pattern. I said before, 35 to 45. When it decrease CO2, when it decrease, it is alkalosis. Increase of CO2, it is acidosis. HCO3, which is the alkali base, from 22 to 26, increase of it is alkalosis, decrease of it is acidosis. Normal PeO2 from 80 to 100, or from 30, or from 10 to 13. Decrease, it is hypoxia. Increase, it is O2 toxicity or O2 therapy. Okay, saturation usually from 95 to 100%, and its decrease is hypoxemia. So please keep all these values. Please keep all this. Okay, then let's discuss, when it came in the exam, how to deal with each ABG. So the first thing your eyes should go towards is the pH, because pH, if low, so I will go for acidosis. If high, I will go for alkalosis. Then the second thing which I will go for is PeCO2 and HCO3. Okay, PeCO2 and HCO3. If I see in the pH, it is acidosis. And the PeCO2 is low, and the HCO3 is low. Which type of this? I have here pH with acidosis, with low PeCO2, with low HCO3. I have first acidosis. Low PCO3 is alkalosis, so it will not correlate with this pH. But decrease of HCO3 is acidosis, so it is metabolic type of acidosis. Again, by another example, when I have pH with alkalosis, I have pH here with alkalosis. Okay, it is more than 7.045. Okay, I have pH here with alkalosis. Then I have high PeCO2 increase and high HCO3. High PeCO2 means acidosis, respiratory acidosis, while high HCO3 means alkalosis, metabolic alkalosis. Okay, so which correlate with that is the HCO3 increased, which is the metabolic alkalosis. But let's discuss about when to say uncompensated, partially compensated, completely compensated metabolic or respiratory acidosis or alkalosis. Okay, we will explain that. I will go for blank page here. Okay, when I say uncompensated, initially to know what are the buffers in the body. Okay, buffers in the body. I have cellular buffer, I have respiratory buffer, I have renal buffer. Cellular buffer, which is the hemoglobin and phosphate buffer. And they are working within seconds, 2 minutes. Seconds, 2 minutes. Respiratory buffer, either hyperventilation or hypoventilation to wash CO2 or to retain CO2. So it works within minutes, 2 hours. Okay, but the renal compensation or the renal buffer by retain HCO3 or its excretion, by retain of H or its secretion, so it will work within 2 days and more. It takes 2 days. So usually when you see renal compensation or metabolic compensation, so it is some sort of chronicity in this disease. Okay, because acute condition will be uncompensated or partially compensated, but will not be completely compensated by renal compensation because it takes 2 days and more. So please keep this 3 buffers in our body: cellular, respiratory, and renal. Okay, then we have when to say uncompensated or partially compensated or completely compensated. In a simple way, uncompensated, partially compensated, and completely compensated. Let's go. When I have, for example, pH is low, this means acidosis or alkalosis. This is acidosis. Okay, then I have the PaCO2 is high, means it is respiratory acidosis. Okay, but the HCO3 here will give me the information about it is uncompensated or partially compensated or compensated. Okay, so here I have acidosis, it is respiratory type, and HCO3 if it is in the normal range from 22 to 26, if it is in the normal range, so there is no compensation. There is no compensation, so it is uncompensated. For example, when I give you the pH is 7.31, this is acidosis. PeCO2, which is from 4.4 to 6, I give you, for example, 6.8. So it is increased. Then the HCO3 here is 23. What is this type? This is here acidosis, here respiratory acidosis, and HCO3 here is normal, so there is no compensation. Why there is no compensation? I have here respiratory acidosis. So the patient will not excrete CO2. The patient has hypoventilation, retain of CO2 in his respiration. So the kidney should compensate that by any of two mechanisms: excrete acids like secrete H hydrogen or retain of HCO3. So when you see compensation for this case, so retain of HCO3, so HCO3 should be increased. Okay, then when you see HCO3 is normal, so it is uncompensated. When you see HCO3 is increased, this is the renal compensation of respiratory acidosis by retaining of HCO3 to neutralize the high PaCO2. So it will be compensated, partially or completely. Then I will look back to the pH. If the pH is still like that, not on the normal range, so it is partially compensated. If the pH became in the normal range, so it is completely compensated. Okay, this is simple. I will repeat again with another example. Here, uncompensation, partially compensated, and completely compensated. I will give you, for example, pH, which is 7.48, 49. Okay, then here HCO3 is 34, while PaCO2 here is 7. What is this type of pH? Here I have more than 7.45, so it is alkalosis. Which of this will go with alkalosis? High HCO3 or high PaCO2? High PaCO2 is with acidosis, so it is not correlated with that. High HCO3, so it is metabolic acidosis. Okay, but here, this is a metabolic acidosis. So it is uncompensated or partially compensated or completely compensated. If PaCO2 in the normal range, so there is uncompensation. But if it is started to increase to compensate the high HCO3, I will start to increase the CO2 to compensate the high HCO3. So it is here partially compensated. But when the pH retained to the normal, it is completely compensated. Okay, let's go for questions. I have here a lot of questions in ABG. Please, I want participation. Okay, then here you are the questions. Who wants to participate, please raise your hand. I'll be with you, no worries. We will discuss together. Okay, Dr. Hesham.
Acute, which one?
Okay, we will start. Here is the theme. There are 5 choices and the conditions which of the following arterial blood gases fit with description below. Here is the question and the answer, but we will discuss each one. Here is 1, 2, 3. Okay, there are 3 questions. Let's go.
Okay. First, acute pH 7.90. 19 BCO2 10.2 BO2 60 bicarb.
Okay, let's leave this answer. And you have here acute respiratory acidosis. So which from these 5 choices will be with acute respiratory acidosis? Okay.
Okay.
What's mean by acidosis? So I will search for the pH.
pH below 7.34.
Okay. In which choice you will find that?
A and C.
Okay.
And E.
And E. Okay. Then it is respiratory type. Respiratory type means that?
Increase in BCO2.
Okay, let's choose from A, C, and E, which increased PeCO2.
Which increased PAE. Uh,
A and C.
A and C, A and C, A and C.
Okay, both of them are with increased PaCO2. Okay,
Yes.
acute condition means it will be compensated or uncompensated.
Means compensate.
Acute condition,
Yeah,
no
mean
compensation.
no compensation.
Why?
No
Because this is a respiratory condition. Compensation of the respiratory condition will be by renal. And renal compensation, I said, it will take 2 days and more.
Yes.
Okay?
Okay.
So it is an acute respiratory acidosis. Which
C.
one will you choose, A or C?
C.
Then you look for bicarbonate. Okay? Bicarbonate. If it is normal, so there is no compensation, and it will be the answer. If it is increased, so there will be compensation, and this is a chronic condition. Okay?
A, because bicarb between normal
Is normal.
is normal.
Okay, but what about the answer C? You can see pH is acidotic, PeCO2 is increased, and bicarb is decreased. What about this answer?
What about this answer?
This is a condition of mixed acidosis. So when you see both of the answers go with acidosis, I have, if you have pH is low and in PaCO2 high and HCO3 is low. pH here is with acidosis. Okay? Increase PaCO2 is acidosis. Decrease HCO3 is acidosis. Okay? So it is mixed metabolic and respiratory acidosis. And the reverse, if you have pH is high, PaCO2, okay, PaCO2 is low, and HCO3 is high. Okay?
Okay.
So please focus with that.
Okay.
Then you can go for the second question.
Metabolic acidosis. Metabolic acidosis with a compensatory respiratory alkalosis.
Okay. Here is some sort of compensation. So choose which is the answer of metabolic acidosis first.
A and C and E.
Metabolic acidosis A, C, E. Okay, that's right. This is why metabolic. Search for metabolic. You search first for acidosis. Okay. Search for the metabolic type.
Metabolic type is
means that bicarb will be
below low. So it low. Is C okay. Or E.
Okay, that's right. Excellent. C or E. Then you will search now for compensation. How to search for compensation?
Search
you will look for
increase,
CO2.
BCO2
it will be increase or decrease?
Increase.
Increase and will cause respiratory alkalosis?
Decrease, sorry. Decrease.
Okay, sorry. That's right. Excellent. So what will be your answer?
What will be my answer? Is E.
Excellent. It will be E. Because here I have pH is acidotic, PCO2 is low, okay? HCO3 is low. When I have PCO2, PCO2 is low, it is alkalosis, not with this pH. But I have here bicarb is low, so it is metabolic acidosis. But why PCO2 is decreasing? Because it will compensate this acidosis, okay? I will do washing of CO2, hyperventilation, because I have metabolic acidosis, increase H in my blood, so I will do hyperventilation to wash out CO2, okay? So the correct answer here will be E. Excellent. Then the third one.
Chronic respiratory acidosis with a compensatory metabolic alkalosis. Acidosis is A and C and E. Metabolic C and E. Compensated compensatory respiratory alkalosis.
Okay, before this question, let's discuss with you. When you see pH is 7O36 or 7O42, this both conditions are normal. Okay, both conditions are normal.
Okay.
When I see 7 or 0.3 means it became compensated from low. So it became compensated from
From
acidosis.
acid.
While more than 7.4, which is the base for them, below
Compensated
it
from
compensation from
above,
acidosis,
but
yes.
from alkalosis
Above
by
it is compensation
excreting
from alkalosis.
alkalosis.
So this is the completely compensation. When you see 7 or 0.3, 7 or 0.7, 7 or 0.37, it is more than 7.4. Okay, 7.4 and less, it is complete compensation from acidosis. 7.04 with high, it is compensation from alkalosis. But they are all in the normal range. This is complete compensation. So here is this condition, chronic respiratory acidosis. So you will think about that respiratory acidosis. So acidosis completely compensated, and this is a chronic condition. So suppose in this condition the pH will be from 7 or 7.35 to 7.39, less than 7.4. Okay, this is the acidosis. If says chronic respiratory alkalosis, it will be 7.041 to 7.045. All of them are normal, but the above here is with acidosis and the lower part here is with alkalosis. Okay, so please keep this. So here, what do you think the answer?
Chronic respiratory acidosis with a compensatory metabolic acidosis within normal range at D or
when you see the first acidosis, so we will go for 1, 2,
BH
and 3. E, C, A. Okay, there are acidosis. But the word chronic will make you add D with them. So you will have 4 choice for chronicity and acidosis. Respiratory. Then I will go for PSO2. You will search for PSO2 which is high. Here is not high, so I will not choose A. Here is high, so it is supposed to be it. Here it is not high, and here is high, so I will search between A and D. Okay, so then I will search again of metabolic alkalosis. What means by alkalosis?
Increase
HCO3. Then I will go, where is high HCO3? Here it is high, and here it is normal. So the correct answer here is D. Every word in each question is very important. Okay, from chronic, I have taken it is a compensated. Respiratory, increase PeCO2. Acidosis, decrease pH. Metabolic alkalosis, increase HCO3. Okay, so please focus. Thank you, Dr. Osama, who wants also to participate. Dr. Yasmin. Okay, welcome, Dr. Yasmin. You can go for this record. April 2020.
76-year-old man admits with the surgical unit, acute abdomen, and found has pneumonia. And nursing staff put in the aunt 15 oxygen non breathing mask. After 13 minutes, the patient red sweat and against the nursing staff. The ABG will be at 7.15 acidosis. And BCO2 10.2 high. يعني metabolic acid still and the oxygen low, and the bicarb 32 high, mean metabolic acidosis.
Okay, you
pH
think this is a
low,
metabolic acidosis.
because the pH low and the CO2 high, like still respiratory
So
need
please focus.
compensation.
Here is
Okay,
pH.
pH
This is
low
acidosis. Okay, this is
and
acidosis.
yes,
PaCO2
and
is
the CO2 high,
high. This is respiratory type. Okay, this
and
is
then
respiratory acidosis. Bicarb
sorry, bicarb high compensation
is
needs
high, means that there
compensation.
is partially compensated respiratory acidosis. Okay,
So,
this is a partially compensated
شكله
respiratory
atelectasis
acidosis.
maybe.
Okay, but in this
This is
patient,
due to atelectasis.
yes, that's right. This patient has a right-sided pneumonia. Okay,
Yes.
and he is taking high flow oxygen.
Yes.
What do you think the cause of this condition in this patient? Okay, you can read the
هو
answer.
major abdominal, هي acute abdomen, the post-operative, and then surgical laparotomy and believe
Okay, do you think it is normal to give patient 15 liters of O2?
No.
Usually we will not use this number. So it is a high flow of oxygen via non-repressible mask. And when you give the patient high O2 and after 30 minutes, the patient should improve, not deteriorate.
Yes.
But when the patient is deteriorate, this confirm your diagnosis with COPD. What do you know about chronic obstructive pulmonary disease?
Second respiratory failure. Yes.
Okay. Chronic obstructive
patient will
pulmonary
lead
disease. Okay, please hear me. Chronic obstructive pulmonary disease is a condition where there is obstruction to the higher airways. So the patient will be CO2 retainer, will not exchange his oxygen probably. So in this patient, there is some sort of hypoxia. And this hypoxia is the initial stimulus for his respiration. Why? We have here central chemoreceptors and the peripheral chemoreceptors. Peripheral chemoreceptors are excited by hypoxia, low PeO2. So it will cause increase his respiratory rate. This makes the patient to take ventilation. So when the patient is in chronic hypoxia, he is tolerated with that and can take his breathing. When you give the patient high flow oxygen, so you will remove this hypoxia. There will be no low oxygen in this patient. So his respiration will stop. So the patient is compensated on his hypoxic drive, which can stimulate his respiration. But when you give the patient high flow oxygen, then the patient will deteriorate. Okay? So this condition is a case of respiratory acidosis partially compensated in a COPD patient. Please keep this question, very important. Okay, then the third one, this question. Okay, go Dr. Hesham.
Hello.
Okay, I'm hearing you. 53 patients. So here in this question, in the previous question, the answer here will be B. Okay, over administration of oxygen in COPD patients. So here is the correct answer. Okay, the second one, another question below.
Patient has acute respiratory acidosis. 35 years old.
No. This is not the question. This is the explanation of the question. Here is the question below.
Okay.
Here is the question.
35 years old man in ICU following the emergency aortic aneurysm repair, develop abdominal pain and diarrhea, and profound unwell. His abdomen has feature of the broken area. What's the following? The ABG picture most likely. Most likely the patient with the broken itis معناها lactic acid high, the metabolic acidosis. I will show
Then you will search
VH.
for metabolic acidosis.
Yes.
Acidosis first. What
Lactic
are the
acid.
options of acidosis? Here.
V. The VH 7 C and D
Yes.
and E.
And D.
COD.
Excellent. Okay. Which type is a metabolic? Metabolic means that
Metabolic mean that bicarb is low
or increased lactate
or increase yes.
or increased lactate. Okay. Please keep this. This is a tricky one.
Lactic increase in D and D and C.
Okay.
COD.
Then what do you think
Then
the answer? What about CO2 in this patient?
and the base X is negative. Yes, and CO2 will increase. Compensation decrease. Sorry, CO2
Will be decreased.
Yes.
Because I have acidosis, I have to wash CO2 by hyperventilation.
Yes, by respiratory. And CO2 3.5. No.
Yes, so your answer here will be C. I have here initially acidosis, which is pH 7.2, and I have increased lactate, then normal PeCO2, normal PeO2, and low BeCO2. Okay, excellent. This is partially compensated metabolic acidosis, partially compensated metabolic acidosis. Another one. Let's go for this theme. These are choices here above, and correlate which of them is with pulmonary embolus. I have here the five answers.
Respiratory alkalosis. And BO low. pH 7. A pH high alkalosis. Yes. And D pH high. And
what are the clinical findings initially? Which will you find in this patient with
respiratory
pulmonary
alkalosis.
embolus?
Respiratory alkalosis and oxygen low.
Yes, excellent. Why respiratory alkalosis? The patient will has tachypnea. Tachypnea.
Yes,
So increase the respiratory rate, and hyperventilation will cause wash of CO2. And what else will you find in this patient? Either than tachypnea and wash of CO2?
And oxygen saturation low.
Yes, excellent. There will be hypoxia. Okay, there will be hypoxia. And it is an acute condition. So there is no compensation. Do you think pulmonary embolus is a chronic condition?
Acute condition.
So it is an acute condition. So there is no compensation. So you will now search for uncompensated respiratory alkalosis with hypoxia. Which of the following has uncompensated respiratory alkalosis with hypoxia? You can search.
A high pH and D high pH and A normal.
What are the choices of alkalosis here first? Alkalosis here is
A and D.
A and E. Yes, excellent. What are
and D.
Okay, A and D. Then increase PCO2 or decrease PCO2 to be respiratory alkalosis.
Respiratory alkalosis, PCO2 low.
Low, excellent. So, and which one is low, A or D?
A.
Okay, you think it is A?
Yes.
Yes, it is A. There is
and
decrease PCO2. Then
الأكسجين normal false.
Okay, so A is the wrong one.
Yes,
so
maybe
A is the wrong one. But
E
here
because
PCO2 also is
low.
high here in D.
هاي PCO2
So
معناه
it is
false.
wrong.
E maybe E.
It is wrong.
The pH highly little bit.
Yes,
And
excellent.
borderline.
Because we are choosing a single best answer. So
Yes.
I was choosing A and D, and both are wrong. So I will go to the
Yes.
nearest
E.
pH to alkalosis. Here I have alkalosis.
Borderline.
Here I have hypoxia, PeO2,
Yes.
7. Here I have low PCO2, means that the patient has tachypnea and he has hyperventilation with wash of PCO2, and I have normal HCO3, means there is no compensation.
Yes.
So the correct answer here is E. This is a tricky one and depends on your clinical data. Pulmonary embolism, the patient will has tachypnea, hyperventilation, wash of CO2, so I will predict to PCO2 to be low. Then the patient will has hypoxia, 3, with the patient will has acute condition, no compensation. Okay? So the second one, what will you find in a patient with ureterosogmoidostomy?
Acidosis, lactic acid. Metabolic acidosis.
Okay. Yes, metabolic acidosis. Excellent. Which will be in this condition? Metabolic acidosis. Choose the metabolic acidosis from above.
Okay. The pH B and C and low pH acidotic. And then
Okay.
B,
B and C.
then,
Yes.
Yes, and then bicarb. The bicarb should be low in B.
Yes, excellent. So your correct answer here will be B. Why B? Because I have pH is acidotic and it is metabolic type. HCO3 should be less than 22.
Yeah.
But in C, it is normal, 27. Okay, so the correct answer of ureterosogmoidostomy is B. Excellent. Then the last one with patient has pyloric stenosis.
Meaning hyperemesis, meaning metabolic alkalosis.
Metabolic alkalosis. Okay, in any patient with gastric outlet obstruction, either congenital hypertrophic pyloric stenosis or malignant stricture in the pylorus, or even chronic peptic ulcer in the pylorus, any condition causing distal gastric outlet obstruction will cause this combination. Please keep this: hypokalemic, hypochloremic, metabolic alkalosis. I will discuss each one. Why initially hypochloremic? Because the patient lost HCl. This is the acid which is found in the stomach. I will lose H, so I will have alkalosis. I will lose chloride, so I have hypochloremia. So here is alkalosis and here is hypochloremia. Why in this patient has hypokalemia? The patient, when he has vomiting and loss of HCl, so it is a condition of hypovolemia, which will stimulate the macula densa of the juxtaglomerular apparatus of the kidney to release renin and activation of the renin-angiotensin-aldosterone system. Release of renin causing release of aldosterone, which cause salt and water retention, but decrease in the potassium level. So any patient with gastric outlet obstruction, congenital hypertrophic pyloric stenosis, malignant stricture, chronic ulcer will have hypokalemic, hypochloremic metabolic alkalosis. So please keep this. So from these answers, in this patient with peptic ulcer and pyloric stenosis, what will be your choice? Dr. Yasmin, do you hear me? Okay, Dr. Mustafaz.
Hello, sir.
Hello, doctor. Okay, welcome. In this condition, what will you choose in patient with peptic ulcer and has pyloric stenosis?
The peptic ulcer with pyloric stenosis. So there will be alkalosis. So I would go for pH more than 7.45. That would match option D, option A, and option D and option A.
Yes. So,
yes, sir.
metabolic.
So,
What means by metabolic?
Metabolic means there would be an increased level of bicarbonate level.
Okay, in A or D has high bicarbonate level.
Sir, there is increased bicarbonate level. I think the option D.
In D, yes, excellent.
Yes.
That's right. So in this condition, the patient will has alkalosis of metabolic type.
Metabolic.
Okay.
Sir.
Okay.
Yes, sir.
Can you tell me it is here compensated or partially compensated or uncompensated?
Yes, sir. I
in
can
this
try,
question?
sir. 7.60. Sir, this is sir, this is uncompensated, sir.
Why? Why you say it uncompensated, but
There is a
PCO2
partial
here is
pressure.
high?
Yes, sir. PCO2 is high. This is partially. Sorry, sir. This is within partially compensated, sir.
Excellent. It is partially compensated. If
Compensated.
PCO2 is normal, so it is uncompensated.
Uncompensated.
It became to increase, it is partially compensated. Why not completely compensated? Because the pH didn't return to normal.
It's still high. Yes, sir.
Yes, excellent. So ABG now, I think it became more easy. Okay, then let's go
Sir.
for anion gap.
Sir, I have
any
a question, sir. Yes, sir. I have a question. Sir, normally we are looking for pH level, partial pressure of carbon dioxide, and bicarbonate level. In special circumstances, we are looking lactate. One example, we have looked for lactate level. When we look for oxygen level or something like that, now or we just follow the main rule. First, we look for the 3 things, then we look for other.
Excellent. Then this repeat questions, and this is depend on the history which is given in the question. Here in the first question, you see a history of pulmonary embolus. So I got
Yes,
the
sir.
answer before going to any of these results. Okay, and here I have ureterosigmoidostomy. I have an answer before going to any results of them. So you know the answer before going to each condition from the history itself. So please don't go for the answer except you try to give the answer from the given history.
Okay, sir.
Okay?
Okay,
You should read the question well before you answer. And here you said the tricky one when you have alkalosis, and we searched here in A and D, and they are all wrong. So I went for A.
Okay.
I took all of them from the given history. So please focus. In the exam, usually 3 to 4 questions from arterial blood gases. Please focus with this. Okay, then I'll continue.